Hi,
Hi, my name is Minsun.
my name is Ngozi Onyema.
Also, I would like to introduce Sister Dorothy Maxwell, who helped us tremendously in the process of data collection for our research.
It's been a pleasure to work with the students of Dominican College in the past 3 years. The sisters who are retired here have been the subject for the research for the students in Dominican. And what I work on when they're not here is their agility, their balancing, their muscle strengthening, and the reaction time through 2 sessions each week. And as the students come in each year, we learn more skills, and they also learn from our sisters how they can better go ahead with their research projects.
The title of our research is In Community Dwelling Females Aged 65 or Older, Gait Speed Declines as Kinesthetic Awareness of the Lower Legs Decreases. The primary focus of our study was to investigate a correlation between the kinesthetic sense of the lower legs and the gait speed through a single snapshot data collection. Furthermore, we collected the number of fall incidences among participants for over 6 months period following the data collection, and we applied these fall incidence data to assess the gait speed as a causative factor of fall incidence. After we had received an IRB approval, we held several information sessions at 3 different locations: St. Dominic's Convent in Bluebelt, Sparkhill, and Nanuet. We recruited study participants there on a voluntary basis during these information sessions. Then we performed a canvas procedure of health screening to select the qualified subjects according to our inclusion and exclusion criteria. For the purpose of our study, we used the non-probability sampling technique of convenience sampling and the non-experimental research method of a descriptive, correlational, and cohort design.
One strength of our study is the use of the gait machine to measure gait speed. The gait machine accurately measures gait speed through computer technology. This is a more accurate way of measuring gait speed compared to manually doing it with a stopwatch. We can be sure that our gait speed measurements are accurate. Another strength of our study is that we realize that leg pain and BMI has an effect on gait speed. So we did some mathematical adjustments of the data with the subjects that had leg pain and a certain BMI level to fairly represent them in our study.
During the course of this research project, we had many great learning experiences while organizing and conducting the information sessions, data collection, and data analysis. Most of all, we had a challenging opportunity to be a creative designer of a kinesthetic ability measurement system. No instrument was available out there for us to use for kinesthetic ability test. We had to design our own system that allows us to assess kinesthetic sense of elderly participants. We designed the kinesthetic ruler, a device to test the kinesthetic ability, and the kinesthetic score system to produce one numerical score for each participant in the range between 0 to 60, where 0 represented the total impairment of kinesthetic sense, and the 60 represent kinesthetic sense intact.
One weakness of our study was our inability to validate our kinesthetic awareness measuring tool. We couldn't find any facility that used the tool for measuring kinesthetic awareness, so we could not compare our tool against a valid one. Another weakness of our study is that our study cannot be generalized because the subjects were only of the female gender, and also our sample size, although meeting the required amount, was very small in relation to the general population. Another weakness is that we did not test inter-rater and intra-rater reliability for the kinesthetic awareness measurements. So we do not know if the method we used to test kinesthetic awareness is reliable through multiple individual measurements or through multiple tester measurements. One threat to our study was the fact that some of the subjects in our study also participated in the falls prevention exercise program. For the cohort portion of our study, where we collected fall incidences of the subjects over 6 months, The exercise program that some of the subjects were in may have affected the subject's risk of fall and been the cause of less fall incidences with the subjects. We give permission to use our video as a Research 1 course material.
You're off to a great start in your careers, and we hope to continue our relationship with the college and the sisters. So thank you very much.
Bye.
Bye.